Voice Arts here. I just wanted to talk about medicine as a whole. Medicine is one of the most beautiful things. It really is. It really is beautiful. But it can be sometimes difficult. Some days you're going to have the moments where you just feel like nothing's going to go right. It happens. It does happen. I've even had those moments where I felt like a lot of people are better than I am. Like feeling that I'm not as good. But then I came to realize later on that I am actually pretty decent. I even have those moments at times. I admit it. But I realized that with other moments, I realized that I'm actually not that bad. I did a revision of a medicated dispositif. Basically, it's a type of anti-contraception, a long duration anti-contraceptive. And I actually did an extraction of that same one that I was actually doing the revision for. And I also, actually another doctor that's actually has a consultorio, or basically a room to consult in the clinic. I also found moments where it's just ecstatic of like finding out a blood type. My blood type is O positive. And yeah, and moments where you just like feel like you can actually do it. This past Tuesday, I actually diagnosed a patient who we already knew had hypertension, but actually with diabetes as well. Like, it's unfortunate that she also got has hypertension and diabetes, but it's better that she knows about it. Like, she was having the symptoms, like, And I also and then when I ended my first year and also entered my third year, I also had moments of pride where there was other people that didn't think I was going to make it to third year. And when I went into the room for, because I did a meeting for third years, entering third years of what clinic you're going to, what hospital, what clinic are you going to, and possible, and how is it going to be run. And many were like shocked that I was even in there because they thought I wasn't gonna make it. And my friend Arturo, he actually was really proud that I actually shut up haters that said no, she wasn't gonna make it. In reality, I did. And also just loving life. And in my first year, there was a lot of doctors, ones that I thought would be doctors and actually move on, that were in my class for first year, but left. Like, they basically dropped out. What in Mexico you called fue de baja. What I'm just basically saying is that medicine is the most beautiful thing, that you're going to have a lot of moments where you're going to have sacrifice. Sometimes you're going to just feel like so tired you do not want to do anything, but you need to study. And you have to keep on going. I say medicine is beautiful. It is beautiful. Don't give up on it. I know it's tough. It's not the easiest thing, but it's one of the most beautiful things because you get to see the science, the humanistic side of science. And that's why I love medicine and anthropology, because they both understand that you must see it in a scientific way, but also in a humanistic way, in how you see the people that you're working with, or the patients that you're treating, or doing procedures like vasectomies, or putting an implant. I actually have put an implant and an extraction, but I had to put be humanistic, be respectful, and in anthropology you have to do the same thing. You have to be respectful and be humanistic. And that's what I appreciate about anthropology and medicine. Later, Loli starts out.